Hi, I'm John, and I'll be going over neuromuscular electrical stimulation. Basically, what I did is set up the protocol from a research article that I read that basically discussed using NMES for preoperative total knee arthroplasties and seeing that if they could go ahead and get them using the NMES units prior to, seeing if they had better functional outcomes post surgery and seeing what their overall progression was. So essentially what they did was for 2 weeks prior to, for 20 minutes each day, they would use the NMES, neuromuscular electrical stimulation, for 5 days a week for 20-minute intervals a day. And the parameters that they used, maximum stimulation at 70 milliamps, frequency of 50 pulses per second. Pulse width, modulation mode is what they were using, but anywhere from 100 to 400 microseconds for the pulse width. It just depended on where they were comfortable with. Their duty cycle or on and off time was 1 second on for every 2 seconds off. That's kind of how they did break it up. And the ramp up was 1 second. The ramp down was 0.5 seconds. Pad placement was on the vastus medialis and vastus lateralis. So as you can see, just kind of set up on the muscle bellies, spread out here, and that's how they set it up. And so one proximal, one medial, the different channels, but going on at the same time. And they wanted to make sure that the patients were seated with foot flat, knee bent to 60 degrees, and hip flexion of about 110 degrees. It varies, and also sitting tolerance and how you prop the patient up. But make sure that the feet were pinned up against the wall so that they couldn't slide when it was turned on. After reading this article, they found outcomes that were beneficial for patients that utilize this protocol, and I would say I would use it in my clinical practice for patients that are about to undergo a total knee arthroplasty.